Thank you, Felicity. I want to echo Felicity's words. Great to be here with the Health Minister, Brad Hazzard, and the Deputy Secretary of New South Wales Health, Susan Pearce, and begin by thanking all our health workers. Over the course of close to 2 years, the work that has been carried out in public health right across the state has been incredibly important in keeping the people of New South Wales safe. And they have been on the front line of a range of things, whether that's in quarantine, whether that's been in the vaccination program and testing, and now, importantly, in our booster shots. And we've seen a substantial uptake in boosters over the course of the last week, and that's incredibly important. Our clear message today is if you are eligible to receive a booster shot, please go and do so. You can do that to your GP, your pharmacist, or at close to 40 vaccination hubs right across the state, just like this one here at Royal North Shore. And to see last week we had around 15,000 people come through and get a booster shot. That's over 50,000 over the course of this week. So that's incredibly pleasing. We've always said vaccination is key to ensuring that we're able to open up as quickly as possible, importantly as safely as possible, and to see so many people go out and receive that booster shot, particularly as we go into Christmas, has been incredibly pleasing. And it's the efforts that everyone is making across our state that ensures that we remain safe and our families remain safe, particularly over the Christmas period. Particularly note in relation to the 5-month period following your second shot that will occur, that many people will become eligible for that booster shot over the summer months heading into April. So please check. There are reminders that are sent out from New South Wales Health, trying to make it as easy as possible to enable people to make those appointments as quickly as possible, as easily as possible, to ensure that we get that booster shot uptake to the level that it needs to be. So I want to thank everybody across the state for their efforts. I also want to acknowledge the many people who have gone out and been tested. Our testing rates, I think, are over 140,000 in the last 24 hours. Now, I know that there's been inconvenience with that, and many people are getting those tests because they are travelling interstate, and in many instances there are wait times, and we know that's been an inconvenience for many, but we very much appreciate the efforts that have been made because the high testing rates, high vaccine rates and booster shots will ensure the protection of our community during this period of time. Also note today that the first dose of vaccination is coming into 95% at 94.9%. That's incredibly pleasing as well. And it's these efforts, these sacrifices that people have made right across our state over the last 2 years have ensured that we keep people safe, we can open up the economy, keep people in work, provide an opportunity for people to remain in work, to look after themselves, and if we can continue over this period of time to treat people with kindness, look out for each other over the Christmas period, we'll get through this like we've got through the last 2 years. Key is today, get your booster. There are 40 clinics around the state. Please see your pharmacist and your GP. 5 months into your second dose, please make an appointment. That's crucial in order to keep yourself safe, your family and your friends safe as well. Now I'm going to pass to Minister Hazzard, who will reiterate some of those important health messages, and then to Susan Pearce to talk about the importance of vaccination and this booster shot campaign.
Thanks, Jim. I think there's only one club that people should belong to here in New South Wales at the moment, and that's the Booster Club. We've just been inside and met a number of people who have made sure they got in early to join the Booster Club, and they're all very happy. Looking at them after their booster shot, they're all looking with a big smile on their face. They're looking like they really do belong to an exclusive club that's going to keep everybody safe. The number of boosters has certainly increased dramatically just in this last couple of weeks. This week, just to yesterday, we had 57,000 booster shots given by New South Wales health facilities alone. And the previous week, we had 15,000. So what we've seen is a quadrupling of the number of boosters being given out. I think that tells us that people are voting with their feet to join the Booster Club. And everybody in New South Wales who is eligible should get into that club. It certainly is one of the major protections that we can have against this worldwide pandemic. I think everybody would remember that for that first year back in 2020, we had our first cases actually on January 25th, 2020. So we're literally 23 months into this pandemic. 25th of January next month it will be the 2-year anniversary. What I'd really like to see is that everybody who is eligible for the vaccine, the booster, and for that matter, if you haven't had vaccine before, for the first and second shots, to have had what they can do to keep themselves, their family and the community safe. We know because the vaccines came to us in February last year, there is a different number of people who are eligible for boosters over the next few months. But by the end of January, we expect that 40% of all people who have been vaccinated will be eligible, and by the end of April, that gets up to 91%. So that reflects the intensity of people's vaccinations last year, particularly between the early part of the year and through to April. Again, I want to thank the health staff. Health staff across this state have been amazing, not just health staff, but the staff who've come in to help health. They have stood up and done enormous hours over the last nearly 2 years to provide quarantine when we had a lot more of the quarantine services, and of course vaccinations, supporting our vaccination program. There's no question our health staff are tired, but they're still there fronting every day. As Health Minister, I just want to add my thanks to the Premier's thanks to all those health staff who have done such an incredible job and will continue to do an incredible job while we're continuing in this pandemic. Finally, I want to say this, that I think we're all hoping for a really good year next year. I think we can still hope for a good year next year. But what we do need to understand is the need to get out and get our booster shots and to still take the basic precautions. This virus is now in this new variant, Omicron. We can't be sure that we won't have other variants along the way, but what we do know is the basic rules still apply. If you've got any symptoms, stay home. Don't put your family, don't put your workmates at risk. If you have any symptoms, go and get tested. Maintain that social distancing. And, of course, if you're in close proximity to people inside and it's a big group of people, consider wearing a mask. A mask still helps to try and stop the spread, but we also have to live our lives in a more normal way coming into 2022. So we will continue to strike the balance. We will continue to look at all of the issues that are happening around the world, but also here in our state, and we'll make sure that people's mental health and the economy is also well looked after by continuing to always look at all the factors that drive New South Wales community as being one of the world's best communities. I think we certainly are exactly that. So we'll strike that balance. Thank you.
The New South Wales health system, supported by GPs and pharmacies, has stepped up at every stage of this pandemic. But the message for everyone now is clear. Get vaccinated. If you haven't been vaccinated yet, there is still an opportunity to be vaccinated. We're seeing more people come through for first vaccinations. Even over this last week, a little uptick there. Every vaccination counts. And while we're still waiting for the many studies that are occurring across the world with respect to the effect of the vaccinations, what we do know about the booster is that it is clear that the booster affords significant protection to you, your loved ones, and to help those health staff who have worked tirelessly for almost 2 years now to battle this pandemic. It is important that we continue to do our bit as individuals to look after ourselves, our loved ones, particularly as we go into this Christmas period. The trend about ICU admissions, and whilst they remain stable, we are keeping a very, very close eye on that. But the trend remains that the majority of people who end up in ICU are not vaccinated or may have only had one dose. That evidence is not just here in New South Wales, but in other parts of the country. So it's a really clear level of evidence about the effectiveness of the vaccines. I've stood before you many, many months ago. We promised to do our bit for the vaccination program in this state. We did more than just our bit. We did a massive amount of vaccination across our clinics. We'll continue to do that. This week, as the Minister has said, almost 60. I think we will get to 60,000 this week when we include today. I'd like to see double that next week. We have capacity in our clinics right now. Get online, make a booking, and please have that booster.
Thanks, Susan.
The difference between the reaction of governments and health authorities in Australia and what we're seeing in Europe and the United Kingdom is very different. So the UK is putting in restrictions, the Netherlands restrictions going in, there's Danish hospitals saying we will be overwhelmed by cases. Are we doing enough? Are we being complacent?
I think we've always struck the right balance here in New South Wales and generally around the country when it comes to the handling of the pandemic. And what has been our leading aspect here in New South Wales has been the effort that everyone has undertaken to get vaccinated. We have, not just here in New South Wales, the highest vaccination rate in the country, but arguably one of the highest vaccination rates in the world. And that enables us to be able to learn to live alongside the virus. I know it seems like a cliche. We've said it numerous times, but now is our time as a state to stand tall, and we can do that because of the efforts and sacrifices that people have made around the state. Now, from time to time, we are monitoring the situation. As Susan has pointed out, well, ICU presentations are still in their 20s. That's incredibly positive. And the other point to make, as already been clearly made as well, is the vast majority of people, not just here in Australia, but around the world, who end up in ICU have been unvaccinated. So this is one last push. We did not believe we'd get to a level of close to 95% first dose when we started this campaign. The efforts that people have made have ensured that we can open up as safely as possible. We've always sought to strike that balance. And ultimately, I think New South Wales is in a very strong place. If you look over the last 2 years, to be in a position where we have incredibly low death rates. And in addition to that, our economy is strong. And we've been able to open up in a way that keeps people in work and allows them to provide for their families. And we'll continue that approach. We'll continue to monitor the situation. The Health Minister and I and our health team speak daily in relation to it. It's a time for calm, but it's also an important time to go out and get your booster shot because vaccination has been key to New South Wales' success. That's not on the government. That's on the people of our state and our fantastic health teams who have been on the front line over the last 2 years.
Premier, what would be your threshold for reintroducing restrictions? No one wants them,
yeah.
But what would it take you to do before mandatory restrictions?
Well, we'll look at that. I mean, what's key to us as well is personal responsibility. And, we've mandated masks in high-risk settings. We strongly encourage the use of that. Everybody today, I think, is responding incredibly well. We monitor the situation. ICU presentations are the key metric for us. And we want to make sure that our health system has the capacity as we move through this next challenge of the pandemic. And I'm incredibly confident as Premier that our health system is the strongest in the country, that we can deal with the challenges that come our way. And my message to the people of our state today is that we can do this. We've got through the challenges of the past and we'll get through the challenges of the present as we move forward through this next stage. We have invested significant amounts in our health system in the lead up to the pandemic, in our vaccination hubs. And as I said to the Health Minister when I was Treasurer at the start of the pandemic, whatever you need, whatever resources you need to keep our health system resilient and strong, you will get, and that's exactly what we've done in our state compared to anywhere else in the country. We have invested significant amounts. As the Treasurer handed down the half-yearly review last week, over $40 billion the government has spent, and that's because we put the people of our state before the budget. That's been our focus through COVID. That's allowed us to keep people safe. That's ensured that our health system has not been overwhelmed, and importantly, it's ensured that we've been able to keep people in work during a very challenging 2 years. But let's look at our success. Let's take the perspective and say we've gone through this together, we've got through this challenge, and we're going to get through the next.
Premier, doctors and nurses are almost universally saying masks should be mandated indoors at least until you see what Omicron does. What's the downside of you mandating?
Well, we strongly encourage it. There will always be different opinions from time to time. I accept that. We have regular discussions. We are always assessing the situation. I've said as Premier, we will tailor our response as the situation evolves, and we will always do that. That's exactly what we've done over the last 2 years. When we believe that there is evidence in front of us that we need to potentially tighten restrictions, we will. And it's almost certain as we move through, as we're seeing overseas, particularly as they head into the winter months, certain challenges will come our way. One thing we know throughout COVID is there'll be curveballs. There'll be things that we don't expect. As the Health Minister has pointed out, there's almost certainly to be other variants that might come our way, and we will need to respond, and we'll continue to work in compact with the people of our state to get us through. One thing's for certain during COVID, and as the Treasurer who sat here and the Health Minister in press conference after press conference, there are always different views, there are always different debates. But what I can assure is what is most important for me and for our government is our number one priority is the health care of everybody across our state. We are completely focused on keeping people safe. But ultimately, in addition to that, we need to learn to live alongside the virus, to move through this, and to date, we are doing incredibly well. As I said, the ICU presentations to date in their 20s. We said as we opened up, and I stood in press conference after press conference when was asked, well, where are the increasing cases? I said the increasing cases will come. But the vaccination has been key. Booster shots are crucial to keep people safe. And as we move through the next phase, case numbers will increase. That is the new normal as we move through this, and vaccination has been key. We need to tailor our settings. We're always monitoring the situation. Our number one focus to keep people safe, and we'll continue to do so. What I ask the people of our state to do today, the key message, is if you're eligible for a booster shot, please go and do it.
So are you expecting any restrictions to be imposed before?
Well, at the moment, as I said with the Health Minister, we every day we're monitoring the situation. Every day we look at the numbers that are in front of us, the hospitalisations and the ICU presentations, and we'll continue to take a balanced, proportionate and measured response. I think the people of New South Wales have made those efforts. We see it regularly today, as we're heading into Christmas, people are wearing masks in settings. We strongly recommend that. In addition to that, there are settings where masks are mandated, and that will be with us for some time. But this is all about taking personal responsibility, and the people of New South Wales are doing just that. The government can't do everything. It's over to the people of our state. It's the people of our state that have got us through the last 2 years, and it's the people of our state that will get us through the next two.
Mr. Hazard, at the moment the curve of cases is going up, and thankfully the line of hospital admissions is saying we're relatively flat. The experts saying to you, are they worried about the admissions will rise in, say, 7 days, 14 days?
I think it's fair to say that the health team is always on high alert and have been and continue to be. There hasn't been a day in almost 2 years that we haven't been looking at those figures. I mean, the Premier just said we talk daily. I think we probably talk multiple times a day about those issues, and we're certainly very closely looking at the total hospital admissions. What we do know is that the more cases you have, the more likely there are to be hospital admissions. But we're also not entirely certain at this point, no one in the world is entirely certain of what exactly the impact of Omicron will be in terms of those admissions. So it can be Delta, it could be a range of other variants that are causing some of the uptick, but the uptick at the moment is very modest, very modest. All I could really tell you at the moment is that quite sensibly the entire health team, and we've got the Deputy Secretary, Susan Pearce, who monitors those figures daily, is watching very, very closely to see what might happen. But it's so difficult. I remember in March, I think it was, March of 2020, we were doing, or Health was doing modelling, but the modelling was based on figures coming out of Italy, Iran, and other countries that weren't naturally analogous to our state. At the moment, the figures here are very low, and so we're also looking at modelling that's coming from overseas. New South Wales is in a very different position at the moment. We're in summer, so we're not seeing that huge uptick of what you'd expect anyway of people entering our hospitals for a variety of other reasons other than just the particular variant that we're dealing, or variants that we're dealing with at the moment. It's very, very hard to distinguish or to understand the full impact until we see more weeks of experiencing what's going on here in New South Wales as to whether or not it's going to really lift our hospital intake or not. But we're on high alert, as you'd expect us to be. 2 years in, we're on high alert. But as the Premier said, and I've just got to say this again, the government can only do so much. It really does come down to the community actually getting on board again. I know they're tired. I know the community is very tired. I think we're all tired. But the reality is the one thing we know that will definitely help is vaccinations. So if you haven't had a first dose, if you're one of those unvaccinated people out there, really rethink your way of thinking. I know some people are locked into this. They've told their mates, they've told their friends, I'm not going to get vaccinated. Well, it's time to set that aside and go and get vaccinated. And for the rest of us who don't have that issue, go and get your booster. Sorry, Angela. Yeah. I just didn't hear what you said. I think I made the point when I talked about those figures the other day that modelling is only, and actually it's similar to what I was just talking about, modelling is only as good as the inputs that you have. And when you don't have a very high caseload directly relevant to Omicron, and we don't at this point have a huge numbers, that's very, and of course there's the lag period as well. You don't quite know we still don't know what will happen after a week or two of people becoming infected. So that modelling was put together by NSW. I think it's considered to be it's excellent modelling, but it also is modelling that has a lot of qualifications around it. And I made that point the other day that we should be. It adds to our sense of heightened alertness, but it's not definitive. It's not locked in. And the one thing that, besides learning to never say never in this job, the other thing is there's always an epidemiologist with a different view. And so I think it's not really appropriate, particularly as it's a cabinet document, to release that at this point. But I will say it's heavily qualified, and at the moment what we're seeing is about 2,500 a day. So hopefully we won't get to 25,000, hopefully. Sorry. Yeah. Look, again, the AMA, I respect their views. I've heard their views, particularly the federal AMA, over the last 2 years, but I think I've also heard a range of other epidemiologists, and I get to watch a whole lot more when I watch your TV programs at night. Everybody's an expert. At the end of the day, we'll take our advice from New South Wales Health and weigh up all of the other issues that we have to weigh up. And I mean by that the broad health system, not just public health, but the health team that looks after people's mental health, people who look after making sure that people should stay in jobs. We'll take the entire health team's advice, and at the moment, I don't see any reason to be jumping down that particular path. Ursula. Sorry, should you say it again?
Previously, called for a target within a 3-month window on the booster instead of 5. In some ways, are we sitting ducks in New South Wales? Given we had the shorter window on AstraZeneca and the longer window on Pfizer, which drops the initial rate of protection anyway, because we're trying to deal with the situation. Are we going to have a situation where people who are already at less protection to begin with have to wait longer, and that's going to be problematic?
I think I've made it very clear that my view, based on the public health advice that I respect, is that it would be helpful to have a shorter period than is currently being designated by ATAGI. ATAGI is obviously a group of experts and a committee, and there are always challenges in any committee to try and get a result. At the moment, they're sitting on the 5 months. I think there are very strong arguments to say that it should come to a shorter period, and if it's not 3 months, possibly 4 months. That presents challenges, though, for the public health team, because obviously we have to get otherwise very tired staff to come on board in greater numbers, because we'll have a lot more people that would then be available and ready for vaccinations. But that's a challenge that I would like to see us at least face up to. In other words, I'd like to see ATAGI shorten the period. New South Wales Health at the moment has certainly indicated in a limited number of circumstances that we will vaccinate in our health clinics from about 4.5 months at the moment. but we'd really like the imprimatur of, I'd like as Health Minister, the imprimatur of Targi to bring that back further. But they are the experts and we're waiting for their advice. We've waited many times for their advice on a range of issues, and generally they get to a particular position which the community can have confidence in, and I would like to see it come back to 4 months.
Last question, please.
Sorry?
Did you go it alone? Did you all bring it up?
Look, yes, we could, but I'd prefer that we have the experts actually come as one. It would help, I think, everybody right across Australia.
Last question, please.
Sorry, there was somebody else? No. Sorry? Thank you very much. No, thank you.
Oh, look, I think obviously I want to thank Shelley Hancock and Don Harwin. I think they have given great service to the state over a substantial period of time, and the people of our great state are better off as a result of the investment that they've made in public service. Public service is challenging, it's difficult, particularly I would say over the last period of time, and Minister Harwin has been a fantastic arts minister. He's held in high regard in the arts community and probably doesn't get the credit that he deserves for the work that he's putting in that space. And Minister Hancock, I particularly note that hasn't really been seen much during the pandemic, but the challenges that we actually faced with local government never came to fruition because she was front and centre in dealing with them. But ultimately as well, after being 11 years in government, it's important that we have renewal and that the government refreshes. So I think this is an opportunity of bringing in maintaining experience in the New South Wales government to keep delivering for the people of our state, whilst at the same time having renewable and bringing fresh energy and new ideas into the cabinet. Obviously, both members have served for many years in the New South Wales government. Spoke to them over the last couple of days, and they'd indicated that given their personal situations, they weren't going to contest, and that's a natural part of being in government for 10 years. But it's a positive thing as well, because we've got very talented people who have been in Parliament who deserve their chance to step up and to serve the people of our state. I've got a great team, and everybody, I think, can make a substantial contribution to getting our state through this next challenge, and it's a good thing. You need renewal in any government, and I postponed that reshuffle when obviously the change occurred. I think that was the right decision at the time, and now is the opportunity to take the team forward, and they'll be making some announcements on that shortly.
Last question.
Just firstly, when do you anticipate that Omicron will become the dominant strain in New South Wales? And if I can follow up on that, obviously we're always waiting on research, and there's always a reason why it's not peer reviewed, etc. But how concerned are you, and how concerned should we be about this?
Look, I think the issue about how dominant Omicron was addressed yesterday, and we know that in our testing numbers we are seeing that S gene drop out. So that was attended to yesterday in the media. With regard to concern, the big missing piece for us at the moment is the severity of this illness. And those are the signals that we're looking for, where everybody, I think, across the world is earnestly waiting and watching the severity. So that will be key to us. And so with respect, for example, to the cases that we're seeing at the moment, our eyes are really on that factor. The number is one thing, but the severity will be the thing that makes the difference, and that is still at this stage unknown.
It's unknown why are masks not mandated as they were a few months ago.
I think the message has been quite clear that, please continue to wear a mask at your own discretion in certain places. It's heavily recommended, clearly. That's been covered this morning. But I think the other key issue, and the Minister touched on this, and I certainly don't say it as, something that, we shouldn't be concerned, but we are in summer, and that puts us in a very different position to those overseas countries in the Northern Hemisphere. Every winter, as you know, we deal with pressure on our hospitals as a consequence, usually in the past, of flu, and that's because of people gathering indoors, etc., etc. So we're in a somewhat different position, but the severity factor is the main signal we're looking for.
Thanks, everyone.
Thanks.
Thank you, everybody. Good day. Bye.